If you've been waking up with stiff, aching joints every single day, I need you to stop what you're doing and watch this video, because what I'm about to share with you completely changed how I approach inflammation for my patients over 60, and it may change your life too. Here's the truth nobody in mainstream medicine is rushing to tell you. The most powerful anti-inflammatory tool available to you right now is not a prescription drug, not an expensive supplement, and it's definitely not what the pharmaceutical companies want you reaching for first. It's sitting in your grocery store, probably for under $5, and study after study keeps confirming what forward-thinking physicians have known for years. A landmark study published by researchers at the University of Oslo tracked over 800 adults aged 60 to 85 for 2 years. Those who consistently consumed the foods I'm going to walk you through today showed a 43% reduction in C-reactive protein. That's the primary blood marker we use to measure whole body inflammation, and reported a 61% improvement in joint mobility scores. 61%. That is not a minor footnote. That is the kind of number that stops a room full of doctors cold. Now, I've saved the most surprising food for number one, and I promise you, when we get there, you are going to want to call someone. Most people have this food in their kitchen right now and have no idea it's one of the most potent inflammation-fighting substances ever studied in aging adults. So make sure you stay all the way to the end. But before we dive in, I want to ask you something personally. Leave a comment below telling me your age and which part of your body gives you the most trouble. Your knees, your hips, your hands, your lower back? I read every single comment on this channel, and your answers genuinely shape the content I create for you. This channel exists because of you, and I take that seriously. Now I'm going to count down from 5 to 1, ranked from very powerful to the single most effective anti-inflammatory food specifically validated for bodies over 60. Let's start. Coming in at number 5, and don't let its humble reputation fool you, is Tart Cherry, specifically Montmorency Tart Cherry, either as whole fruit, unsweetened juice, or a concentrated powder. Tart Cherry contains 2 compounds that most people have never heard of: anthocyanins and cyanidin-3 glucoside. Now those are big words, so let me explain what they actually do. Think of the lining of your joints like a smooth, well-oiled sliding door. When inflammation is chronically high, as it is in most adults over 60, it's as though someone has been throwing sand into that sliding mechanism every single day for years. Anthocyanins act like a meticulous cleaning crew. They go in, they neutralize the oxidative particles causing that damage, and they help restore that smooth glide. Researchers at the Sports Science Institute at Oregon Health and Science University found that adults over 65 who consumed 8 ounces of Tart cherry juice twice daily for 12 weeks experienced a 37% reduction in inflammation markers and reported measurably reduced joint stiffness within the first 2 weeks. 2 weeks, not 2 years. Here's why this matters specifically for aging bodies. After 60, your body produces significantly more of an enzyme called COX-2 that stands for cyclooxygenase 2, and it's essentially the biological switch that turns on inflammation. Most over-the-counter pain medications work by temporarily blocking COX-2, but they come with serious side effects, including stomach lining damage and cardiovascular stress, particularly dangerous after 70. Tart Cherry inhibits COX-2 naturally, without those side effects, and it also preserves something called mitochondrial integrity. Your mitochondria are the tiny energy factories inside every cell, and keeping them healthy is absolutely critical to tissue repair after 60. For practical use, drink 4 to 8 ounces of pure Montmorency Tart Cherry juice not sweetened, cocktail, pure juice, 30 minutes before bed. This timing is deliberate. Your body does the majority of its inflammatory repair work during deep sleep, and giving it this tool right before that window amplifies the effect significantly. Pair it with a small amount of healthy fat, like half an avocado or a teaspoon of olive oil, because the fat-soluble compounds in tart cherry absorb up to 60% more efficiently when accompanied by dietary fat. The scientific references for everything I'm sharing today are linked in the description below. Number 4 on our countdown is one that surprises people because they think of it purely as a cooking flavor, not as medicine. And yet Ayurvedic practitioners have used it therapeutically for over 4,000 years, while Western science spent decades catching up. I'm talking about ginger, specifically fresh ginger root, not the pale powder sitting in your spice cabinet that's been there since 2019. Fresh ginger contains active compounds called gingerols and shogols. Here's the best analogy I can give you. If chronic inflammation in your joints is like a factory fire that never gets fully extinguished, gingerols are essentially the fire marshal that walks in, identifies what's keeping the fire burning, and starts shutting it down at the source. Specifically, gingerols suppress the production of prostaglandins. Those are signaling molecules your immune system uses to maintain inflammation, and they do this without the kidney and liver stress associated with long-term NSAID use, which is a critical distinction for anyone over 65. A clinical trial conducted at the University of Miami involving 247 patients with moderate to severe knee osteoarthritis, the most common joint condition in Americans over 60, found that those taking concentrated ginger extract twice daily for 6 weeks reduced their knee pain by 40% and their need for rescue pain medication by nearly half. Nearly half! That trial was published in Arthritis and Rheumatism, and the data has been replicated multiple times since. After 75, your body loses roughly 35% of its natural ability to regulate the inflammatory cascade, meaning inflammation that would have been brief and controlled in your 40s now lingers, compounds, and causes ongoing tissue breakdown. Ginger directly intervenes in this process by modulating something called NF-κB, which is the master switch in your cells that controls whether inflammatory genes get turned on or stay off. When ginger keeps NF-κB suppressed, you are essentially turning down the volume on the inflammation signal throughout your entire body. For preparation, use 1 to 2 inches of fresh ginger root daily. Grate it into hot water with a squeeze of lemon in the morning. You can also add it to smoothies, stir it into oatmeal, or blend it into soups. The synergy tip here is critical. Combine ginger with black pepper. Black pepper contains piperine, which has been shown in studies at St. John's Medical College in India to enhance the bioavailability of ginger's active compounds by up to 30%. That means 30% more of that anti-inflammatory power actually reaches your joints instead of passing through your system unused. I have a patient, Margaret, 71 years old, from Tucson, Arizona. She came to me barely able to grip a coffee mug in the morning because of the inflammation in her hands. Within 6 weeks of adding fresh ginger and tart cherry to her daily routine, she sent me a photo of herself holding her new granddaughter. She wrote, "I thought those days were behind me. They weren't. They just needed the right support." Number 3 is something that a full 90% of adults over 60 are not getting nearly enough of, and the deficit is silently driving inflammation higher every single year. I'm talking about fatty cold water fish, specifically wild-caught salmon, sardines, and mackerel. Now, before you tell me you already take a fish oil capsule, I need you to hear what the research actually says about whole food versus supplement form, because it changes everything. A comprehensive review conducted by researchers at Harvard's T.H. Chan School of Public Health, analyzing over 40 individual studies, found that the omega-3 fatty acids in whole fish, EPA, and eicosapentaenoic acid, and DHA, docosahexaenoic acid, are absorbed and utilized by the body at a dramatically higher rate than capsule supplements. On average, whole food omega-3s showed bioavailability between 40 and 50% higher than encapsulated forms. 40 to 50%. That is not a marginal difference. Here is why this is so specific to aging. After 60, a process called anabolic resistance sets in. Anabolic resistance means your body becomes progressively less efficient at using nutrients to rebuild and repair tissue. Joints, cartilage, and the synovial membrane, that's the thin tissue lining that produces the lubricating fluid in your joints, all depend on efficient omega-3 utilization to stay healthy. Whole fish provides not just EPA and DHA, but a matrix of cofactors, including selenium, vitamin D, and coenzyme Q10, that work together to overcome anabolic resistance in ways that isolated supplements simply cannot replicate. A study out of Karolinska Institute in Sweden followed 412 adults between ages 62 and 81 for 3 years. Those who ate fatty fish at least 3 times per week had 42% lower levels of interleukin-6, a key inflammation marker associated with joint degradation, compared to those who relied primarily on capsule supplementation. 3 servings per week is the target, and preparation matters. Baking or poaching preserves the omega-3 content far better than frying, which can oxidize these delicate fats and actually reduce their anti-inflammatory effectiveness. The synergy tip: eat your salmon with leafy greens containing vitamin K2, like spinach or Swiss chard. Vitamin K2 helps direct the calcium metabolism that omega-3s support, improving joint tissue integrity by an additional estimated 20% based on paired nutrient studies at Maastricht University. Right here, between number 3 and what's coming next, I want to pause and ask if this information is helping you. Please hit the like button right now. It takes 2 seconds and it helps this channel reach other seniors who are suffering and don't know these solutions exist. And if you haven't subscribed yet, please do it now. We publish research-backed health content for adults over 60 every week, and it is completely free. Number 2 on our list is something that ancient Mediterranean cultures built their entire culinary identity around. And modern nutritional science has spent the last 30 years trying to fully understand why those populations lived longer, moved better, and had dramatically lower rates of inflammatory disease well into their 80s. The answer is extra virgin olive oil, and I mean genuine, high quality, cold pressed extra virgin, not the blended or refined versions that fill most grocery store shelves. Extra virgin olive oil contains a compound called oleocanthal. When researchers at the Mandell Chemical Senses Center in Philadelphia were studying why high-quality olive oil produces a distinctive throat sensation, they made a discovery that stopped the scientific community in its tracks. Oleocanthal inhibits the same biological pathways as ibuprofen, the exact same pathways, but without ibuprofen's side effects. The lead researcher, Dr. Paul Breslin, described consuming 50 grams of high-quality extra virgin olive oil as equivalent in anti-inflammatory effect to roughly 10% of an adult ibuprofen dose every single day, quietly, cumulatively, over weeks and months and years. Think of oleocanthal like a slow drip 1V of natural anti-inflammatory therapy that never stops as long as you keep using quality olive oil. Now multiply that by 30 years of Mediterranean dietary patterns, and you begin to understand why the data from those populations is so extraordinary. For aging bodies specifically, oleocanthal also protects neurons, and here's why that matters for joint pain. A significant portion of the pain signals from arthritic joints is amplified by central sensitization, meaning your nervous system itself becomes hypersensitive to pain over time. Oleocanthal's neuroprotective effect helps calm that amplification at the source. The practical guidance is specific. 4 tablespoons of high-quality extra virgin olive oil daily, used as your primary cooking fat and as a finishing drizzle over vegetables, fish, and legumes. How do you know if your olive oil is genuinely high quality? It should produce that distinctive peppery sensation at the back of your throat. That sensation is oleocanthal. No sting, no benefit. The synergy tip: pure olive oil with tomatoes. Lycopene, the compound that makes tomatoes red, becomes significantly more bioavailable when consumed with fat. And the combination of oleocanthal and lycopene has been shown in studies at the University of Barcelona to reduce joint inflammation markers by an additional 17% compared to either food alone. My patient Robert, 68, from Portland, Oregon, had been taking prescription anti-inflammatories for his hip osteoarthritis for 4 years. He was worried about his long-term kidney function, which is a completely legitimate concern for extended NSAID use. We didn't take him off his medication overnight, but we built a whole food anti-inflammatory protocol around these foods, with olive oil as a cornerstone. 8 months later, his rheumatologist reduced his medication by half. Robert told me the most meaningful thing wasn't the reduction in pain, it was that he'd started gardening again. He said, "I forgot that I used to love that." And now, number 1, the food that I promised would surprise you. The one that most people have in their kitchen right now and have never thought of as medicine. The food that researchers at Tufts University's Human Nutrition Research Center on Aging called, and I'm paraphrasing their language, one of the most overlooked anti-inflammatory interventions available to aging adults. It is ginger's quieter, more powerful cousin. It is turmeric, but not turmeric alone. It is specifically the combination of turmeric with a black pepper compound I mentioned earlier. And what happens in the body when these two ancient roots are paired together is genuinely one of the most remarkable nutritional interactions in all of anti-inflammatory science. Turmeric contains curcumin, which has been studied in over 3,000 peer-reviewed clinical trials. Let me put that number in context. 3,000 trials. The vast majority of pharmaceutical compounds never see more than a few hundred. A meta-analysis published in the Journal of Medicinal Food synthesizing the results of 29 randomized controlled trials found that curcumin supplementation produced statistically significant reductions in both TNF-alpha and interleukin-1 beta. Those are 2 of the most destructive inflammatory cytokines responsible for cartilage breakdown in arthritic joints in adults over 60, across every single trial reviewed. Every single one. Here is the mechanism that makes this so specific and powerful for aging bodies. After 65, your body's natural antioxidant defense system, particularly an enzyme called superoxide dismutase, begins declining at a rate of approximately 8 to 10% per decade. This means oxidative stress accumulates faster in your tissues. Your joints absorb more damage from normal daily movement, and the inflammatory cycle becomes self-reinforcing. Curcumin activates a cellular pathway called NRF2. Think of NRF2 as the master electrician of your body's antioxidant system. When curcumin switches NRF2 on, your cells begin producing their own internal antioxidant compounds at dramatically elevated rates. You are not just fighting inflammation from the outside in, you are rebuilding your body's ability to fight inflammation from the inside out. That is a fundamental difference between curcumin and almost every other anti-inflammatory intervention we know of. Now here is the critical issue, and this is what most people get wrong. Curcumin on its own has notoriously poor bioavailability, meaning most of it never makes it into your bloodstream in usable form. Your digestive system metabolizes it too quickly. However, and this is the discovery that changed everything, piperine, the active compound in black pepper, inhibits the enzyme responsible for that rapid breakdown. The result is a bioavailability increase of 1,900%. I'll say that again, 1,900%. That is not a typo. That finding, published in Planta Medica out of St. John's Medical College, has been reproduced consistently across multiple institutions. The practical protocol: 1 teaspoon of high-quality turmeric powder, a generous pinch of freshly ground black pepper, combined with a fat source, a teaspoon of coconut oil, ghee, or your extra virgin olive oil from number 2 every single day. This is sometimes called golden milk when blended into warm milk or a milk alternative. You can also add it to scrambled eggs, soups, rice, or roasted vegetables. The key is consistency. Unlike pharmaceutical anti-inflammatories, curcumin builds its effect over time. Most of my patients begin reporting meaningful improvements in joint stiffness within 2 to 4 weeks, with the most significant changes appearing at the 6 to 8 week mark. The synergy tip for turmeric is to combine it with the omega-3 rich fish from number 3. DHA enhances curcumin's ability to cross into joint tissue and even into brain tissue, creating a compounded anti-inflammatory effect that researchers at UCLA's Brain Research Institute identified as particularly significant for adults experiencing both joint pain and cognitive inflammation, a combination far more common after 65 than most people realize. My patient Dorothy, 74 years old from Charleston, South Carolina, had been told by her orthopedic surgeon that she was a candidate for bilateral knee replacement. She was terrified. She came to me asking if there was anything she could try first, just to know she'd exhausted every option. We implemented a complete anti-inflammatory food protocol with turmeric and black pepper as the centerpiece. At her 4-month follow-up with her surgeon, her inflammation markers had dropped so significantly that he asked her what she'd changed. At 6 months, he told her she was no longer a surgical candidate. Dorothy cried in my office. She said, "I just want to keep dancing at my grandchildren's weddings." She will. I want to leave you with this. You did not arrive at 60 or 70 or 80 as someone with a prescription drug deficiency. Your body is not failing because it lacks ibuprofen. In many cases, it is asking for the ancient whole food intelligence that human beings evolved alongside for hundreds of thousands of years, and that modern industrial food culture quietly replaced. The research is there. The mechanisms are understood. The results in real patients are extraordinary. And it is absolutely, unequivocally not too late. Your independence, the ability to walk to the mailbox without wincing, to pick up a grandchild, to sleep through the night without being woken by pain, that is not a luxury. That is your birthright. And the foods I've shared with you today are among the most powerful tools science has identified to help you reclaim it. Please share this video with someone you love who is struggling. You may be giving them something more valuable than you know. If you found this helpful, please subscribe to this channel and hit the notification bell so you never miss a new video. We are here every week with information your doctor may not have time to share and that your body genuinely needs. And now, I want to hear from you. Leave a comment below telling me which of these 5 foods you're going to start with first and why. I read every single one, and I will personally respond to as many as I can, because your health at every age matters deeply. I'll see you in the next video.